What's your first name?
Kelly with a Y.
All right, go ahead, take a seat. I will let them know you're here.
Thanks.
Sitting in the waiting room, I've checked in and I don't really know what to expect. I'm definitely nervous because of the unknown, but I know this is something that is good for me, especially as a mom of 2 little kids. I want to be around for them, so that's why I'm doing it.
Thank you.
Was that easy to fill out?
It was. It was all information that I knew off the top of my head. Nothing that I needed to really look up or, I mean, I'd think back about a date of a last appointment, but other than that, I knew everything.
How are you doing?
I'm nervous.
You're nervous?
Yeah.
Why are you nervous?
I don't know. It's really silly. I get preventative care all the time, but it's just, you know, a woman. It's an intimate thing and it's nerve-wracking. Especially as you look around, October's coming up, it's going to be pink everywhere, and there's a reason it's pink everywhere because this has impacted a lot of people.
Kelly?
Hi.
Jennifer.
Nice to meet you.
Come on back. Up here on the right. Thanks for coming in today. Here at DuPage Medical Group, we are offering free clinical breast exams during October, just as one more thing that you can do to catch breast cancer at an early stage when it's incredibly curable and very treatable. What about clinical or self-breast exams? Do you do those yourself?
Probably not as much as I should.
Okay. I would say most people are in your same boat where they might do self-breast exams here or there, might not be consistent. For a while, you know, they weren't even recommended because women wouldn't know what they were feeling and they would get more anxious, like, what is that? What is that? But our stance on it is we want you to be breast aware and aware of changes. So you would be able to notice a change. You know, if you feel something, if you see something, you would know that, wait a minute, that wasn't there a month ago, or that wasn't there a couple weeks ago. So I'm gonna talk to my doctor about it. Part of that is actually looking at your breasts in the mirror each month. What you're looking for, if your nipples typically stick out and then all of a sudden one's pulling in, that would be a concerning sign. If you had a dimple in the breast, which would be like an indentation, if you noticed a change in the size or the shape of your breast, or nipple discharge is something else that, you know, if you notice it, it would be something to evaluate further. Lump might feel like a frozen pea. So any of that you feel would be something to let your doctor or your provider know.
Okay.
Okay? Do you have any questions?
What exactly are you going to do?
So today we're gonna do a clinical breast exam.
Okay.
What that is it's in a couple different positions. We'll have you lay down, we'll have you sit up, and I'll be feeling for any signs of anything abnormal. You know, we're gonna be feeling both breasts. It doesn't take very long, it's not uncomfortable, and I think you'll do really well.
Okay, cool. Thank you.
Sure. I'm gonna have you change into this gown.
Okay.
It opens in the front, and then I'll be back in a couple minutes.
Okay.
All right.
Thank you.
Yeah.
Okay, it's time to change, so we're going to be turning the camera off for a moment.
So how was it?
So it wasn't bad, thank you so much. It was really quick, it didn't hurt at all. I think the biggest issue was just being nervous, but like as you said, okay, this looks good. It makes you feel a lot better, but I appreciate all the tips and guidance you gave on actually doing a home self-breast exam because I didn't know all of that, and especially the time of the month mattered to do it too. I was never told that.
I think all that stuff helps. So, you know, it's not as bad as you might think it is. You know, it's helpful to feel good afterwards and have almost a sense of relief or a sense that you are doing everything that you can do to reduce your risk of breast cancer or even catch it at an earlier stage.
Mm-hmm. And no, I'm a huge proponent of preventative care, so
Perfect.
I agree with that.
I would add continue mammograms each year now that you've already started your mammograms a couple of years ago, so continue on that same screening path once a year, hopefully at the same time or, you know, close to that same time. Have your mammogram. have a clinical breast exam once a year too.
Okay.
So whether your primary care doctor is doing it, your gynecologist is doing it, just make sure that you get that done once a year.
Okay.
All right.
Perfect.
Any
Thank you.
questions?
I don't have any, but I appreciate all of it. Like I said, you gave a lot of information that it's funny, as a woman of my age, I did not know. So
I'm glad.
Thank
I'm
you very
so
much
glad
for
you
that.
came in. Yeah.
Thank you.
It was nice meeting you.
Very nice meeting you.
Take care.
Okay. Okay, so I'm done with the exam. It was super easy. It did not take any time at all. It didn't hurt. I feel so much better. The worst part about everything was really just thinking about what they could find, but to know instant gratification that everything seemed normal was amazing. And it also got a lot of helpful tips as to what I should be doing on a monthly basis, and of course to maintain regular breast exams and mammograms every year, which is not at all hard to do. So I'm glad I did it. It was a good experience. It made me feel a lot better. But now it's your turn. You need to call DuPage Medical Group. You're going to start seeing pink everywhere for the month of October, and they're offering free breast exams for women. Get yours and have this feeling of, whew, it's all okay at the end of it.